So the title of the project is Medical Marijuana, Emerging Adults and Communities, Connecting Health and Policy. It's a 5-year study funded by the National Institute on Drug Abuse, and the primary focus is on young adults in Los Angeles aged 18 to 26. So the project emerged out of the Proposition 215, which came about in California in 1996, which allowed the legalization of marijuana for medical use. But at the time, there wasn't really a thought that there would be substantial numbers of young adults who would get recommendations for marijuana. And in recent years, increasing number of young adults have received recommendations. So the study is really about trying to understand whether this is a good public health policy for young adults. The study is going to involve recruiting both medical marijuana patients and what we're calling non-medical users, about 190 of each. There's going to be a quantitative phase and a qualitative phase, so it's a mixed method design. And we're interested in 3 kind of primary aspects. We're interested in how does medical marijuana play a role in current patterns of drug use, both marijuana but as well as illicit drugs, alcohol, prescription drugs. What role does medical marijuana play in the overall health of medical marijuana patients, whether it's things that they may have received a recommendation for around chronic pain, anxiety, insomnia. Basically, how does it influence or impact their overall health? And then the third area is the medical marijuana dispensary or collective. So that's the institution that's charged with dispensing marijuana to patients in Los Angeles. We're interested in understanding what kind of, in addition to dispensing marijuana, what kind of support do these institutions offer young adults, such as support groups, alternative medicine, kind of putting them in contact with other networks of young adults. Ultimately, we hope that the project will give us guidance and could potentially influence policies in other states that allow medical marijuana for legalized medical marijuana. Currently, there's 20 states that do allow medical marijuana. So we're hoping that we'll be able to provide some insight into whether this is a good policy overall for young adults, both in Los Angeles and the state of California and in those other states that have medical marijuana laws on the books and those that are considering medical marijuana, such as Pennsylvania.